So we have a patient panel to finish off our morning. We are on schedule. Again, who would have thought that I would be on schedule, right? I will make one correction on the agenda. None of us have any idea who Jeffrey Lamont, MD is. So, do you know Kristen? Okay. So he's not moderating it, I'm moderating it. So we've had volunteers. We've had several of our patients who have agreed to come up and talk a little bit about themselves. We don't want to pressure them to say anything they don't want to, obviously, but we'll have them come up and just kind of go through, just introduce themselves. They don't have to say, if you want to say first names, it's fine, and talk about their experience, and then we'll open the floor up for questions, and we'll have some more great interaction, and then we'll finish up the day. So you know who you are, come on down. I'm going to let Ken go first, and Ken just whispered to me. I don't know how to follow that. I don't think any of us do. Yeah, I think so.
My name is Ken Miroff, and I've been with Dr. Whitman and Dr. Spickenback for 3 years now. And my heart goes out to you, Don. I don't know how to follow that as well as you did, but I've had skin issues for many years, between squamous cells and basal cells and Mohs treatments. The last treatment I had, what I thought would have been Mohs, was then relegated to Dr. Pickenback's artistry for removing a melanoma from my scalp. And then about a year ago, a bunch of tumors started coming back on my scalp. And I started with Dr. Whitman. And again, his entire staff, Mary, Maureen, Ms. Rosa. It's just wonderful coming here, even though it's under negative things. But I started on Yervoy, and after 2 infusions, the side effects put me in the hospital, and I couldn't continue that. So after getting 80 milligrams of prednisone, they had to wean me off of the prednisone, and I started with Opdivo. And after 1 infusion of Opdivo, I had to go to the hospital again for the side effects. So under the tutelage of Dr. Whitman, and he contacted Sloan Kettering to see if they had anything else on their docket, and they said, you're doing all we have. So we waited a little bit, and he asked if I would go on this clinical trial of another drug by Amgen. So I had nothing to lose, so we went on Amgen, and then Mary and Maureen hermetically sealed my head for 2 days after injecting my whole scalp, and it worked. And another 2 weeks later, and with minimal side effects. Just had 1 day of a flu, and then it was clear sailing for a week. Removed the bandage, wait another week, and start another injection. So, and it started, and then my wife and I went away under the trial program, and while we were away, the FDA approved it into enlarging. And I was still getting the shots, and the tumors were minimizing themselves, and I had a few more infusions, and then a CAT scan, and the CAT scan showed that there was no more melanoma on my scalp, just a couple little activities in my body. And but having said this, the infusions of Yervoy or Opdivo did heal another sore that was on my leg that was going to get treated later on, and today there's nothing there. So I owe my opportunity and my involvement with today to Dr. Whitman and his staff, and of course my wife. It's very, very difficult for the caregiver to be around and listen to her husband or their loved one say the night before when he goes to sleep that I hope I don't wake up in the morning. And, but now it's another life, and it's wonderful being here. So thank you so much.
Tell you that I owe Dr. Whitman my life. And
Wait.
No, I know that, but I also just want you to know that 20 years ago, when I was diagnosed with Dr. Whitman, I was lucky enough to land in his office. And when he wrote the note, would I please come and speak, I was really quite surprised, very honored, and actually quite humbled. And after hearing some of the research that's going on today and some of the most innovative practices, I told him a few minutes ago, I feel like I'm ancient history because none of my experiences are probably at all relevant to what is occurring today. But certainly I want you to know that what I always found with Dr. Whitman was that he was very clear about outlining the options, looking at the strategies, and to discussing those kinds of pros and cons, and always looking at really creative, safe innovations, as well as what I used to affectionately refer to as slicing and dicing. And I know he kind of grins every time I say that. So anyway, I was diagnosed 20 years ago. During that time, I've had 14 surgeries. I participated in 3 innovative at the time research studies, although none of them, to my knowledge, have been approved by the FDA, and none of them were mentioned this morning. I was diagnosed in 1998, as I mentioned. At 48 years old, I was the CEO of the Alzheimer's Association and living a very, very busy professional life. Now, before I talk a little bit about my journey in a little bit more detail, I just want to share a little bit about my background so to give you a sense of who I am. My father was a doctor, a surgeon no less, so I'm certainly familiar with that world, if you will. He died in the mid-'80s from Alzheimer's disease, and I was, at the time of the diagnosis of cancer, was the CEO of the Alzheimer's Association, so you can see the irony there. As a young child, we spent our days, our summers at Lake Okoboji, the most beautiful lake in the entire world, and of course we spent lots and lots of time in the sun. And I remember as a little girl getting so badly sunburned that I was blistered and I had to wear my brother's t-shirts, you know, the white t-shirts he wore as underwear, and I was absolutely humiliated. And that was probably the genesis of my melanoma. So when I first went to the doctor, now this is not Dr. Whitman, if you will, but in St. Louis, when I was suspicious of some spots that I had, I told him that I had this itch on my back that had been bothering me for several months, maybe even longer than that, a year. And he said, and I quote, "Well, it doesn't look like anything to me, but if it's bothering you, I'll remove it." Well, a week later, after having sent the specimen off to Harvard for it to get determined what it was, it came back as being something called neurotrophic melanoma, a very, very rare melanoma. So Anyway, long story short, luckily I was enough out to land in Dr. Whitman's office, who had just come to St. Louis after doing a practice internship or fellowship or practice whatever at the National Institute of Melanoma, and he was doing a practice at Washington University School of Medicine, so that I knew that once I was in his hands, I was in very good shape. At that point, he did a wide back excision, and then from that point, he discovered it had already gone to my lung. There was suspicion that it was actually in my liver at the time. So here I was right out of the bat. That was my initial diagnosis at stage 4 melanoma. So through his leadership and through his practice, certainly we did the surgeries to remove it. But also at that point in time, he was able to get me, he did the lung, he didn't do it, but he had arranged for it to do the lung excision, what do you call it now? Anyway. Yeah, and so anyway, and it was then after that point I took my first experimental innovative research, and that was interleukin, and I gave myself shots for about 10 months, clean and clear. Then Dr. Whitman arranged for me to go to San Diego when I had apheresis, where they took blood out of my jugular vein, treated it with their fruit flies or whatever it is, or some kind of immunobooster, and they put my blood back in. Thank you. And then I was clean and clear again. And then about a year later, I had some very severe back pain. Was admitted emergency into the hospital, and lo and behold, what they found was that there was a tumor that had shown up in my intestine that was pressing the nerves for my back. So once again, I had emergency surgery, and then it was at that point after that I was put into intensive care, and at that point, knowing that I was stage 4, that it spread throughout my body, and plus there was a suspicious spot on my liver, it was at that point that my life projection was 3 to 6 months. And so that certainly took me back a little bit, but it just continued to move forward. And then fast forward another year or two, and I was clean and clear again. I went out to see Dr. Whitman for a checkup, and I noted to him that I was having some headaches, and I never left the office. The next day, they had brain surgery, removed a tumor from my brain, size of a golf ball, and yeah, right. Right, that was in 2000, and so he has all the dates taken care of. And then about several months later, I had some radio brain surgery just to make sure that the margins were clean. So here we are, 14 surgeries, 3 innovative practices, and really I only had one complication from all of that, and that was some brain seizures because of those loose brain cells that were running around. So I had gone on to an anti-seizure drug for a while. I talked to the neurosurgeon about could I please go off of it. He explained to me that it was quite risky to go off of it, but if that's what I wanted to do, that he would allow me to do that. Well, lo and behold, several months later, I had a massive brain seizure in Chicago. I was working in Chicago at the time at the National Alzheimer's Association, and was rushed back to St. Louis to see Dr. Whitman and the neurosurgeon. And then since that point, I've been taking Dilatin, and that's the only drug that I take at all. Since that time, I've been clean and clear. And I've really been very fortunate in really having the kind of success that I've had for 20 years. But I also want you to just talk a little bit about my kind of reaction or emotional responses to the disease, because I think that's also a big part of who we are. The hardest times for me, the most stressful times for me, were when I was going in what I was called limbo land, and that was when I was waiting for test results to come back, when I was waiting to put a plan of attack together, kind of when you just don't know quite what the next step is. Well, that was very difficult for me. And also, one of the research studies that I participated in was a chemotherapy intervention, and it was the Dartmouth regiment. And it was very toxic, and it required intensive care for 3 days, and then out, and then 2 days in, or another treatment in. And at that point, I just said, I quit. I've had enough. After 2 treatments, I was supposed to have 4, and I just said, I'm not going to do it. Enough is enough. And I made the decision at that point in time that I would rather live a short little life than to have a long pro-life that was compromised to the level of toxicity that particular experiment created. So that was a difficult time for me. I also had wonderful support from family and friends and from the staff that were at Dr. Whitman's office at the time in providing, their kinds of support that I needed post-treatment, post-surgeries and post-treatments. But I did work the whole entire time. I never, ever stopped working. It was really about, for me, taking one day at a time and moving forward. I never went through the anger stage of why me, that is so common with so many people. It was really, for me, it was about getting my head and heart aligned, and I think Dr. Whitman mentioned that earlier, and then putting a plan of attack together and then moving forward with that. Now, that's not to say that there were not times of fear, sadness, overwhelmment, but I really tried to keep focused on moving forward and moving ahead and having a life that is of quality as I wanted it. There were some times, though, I have to tell you, that some of my friends and family had a very different reaction to me. Some of them wanted me to stop working. Some of them wanted me to go take a special trip. Some of them wanted me to go do things that they thought that they might want to do. And I think that that's one thing that, that wasn't who I was, I'm a pretty independent person, and, I was really focused on just continuing to have one day, and to live that to the fullest that I could. And I also have to tell you that I had lots of joys, and really days of humor through it all. And I think that also was one of the reasons that, kept me moving forward. So who's to say today? I mean, was it the 14 surgeries that I have and all my tattoos? Is it because of those innovative, drugs that have never been approved by the FDA? Is it because I have Irish blood and a lot of tenacity? Who's to say why I'm alive today? What I do know that 20 years, I haven't had a symptom since. I go to the dermatologist every 3 months. I'm very diligent about that. I have had lots of basal cells, I've had lots of squamous cells removed, but I have not yet had any melanoma show up. If I do, I'm on the next plane out to New Jersey.
My name is Nikki. I'm 29 years old. I was diagnosed with melanoma about 2 years ago now. I was never a tanner. I had a lump behind my ear that eventually started getting bigger, and finally found a doctor that was willing to investigate it more than just draw some blood, and turned out to be melanoma. So after I had that removed, I was being treated at another institution, and I won't call them out, but not really liking the options I was presented with. I did my own research and found Dr. Whitman in Morristown Memorial, and decided to come down here and be seen by him. About 4 months after my first surgery, the melanoma came back. It had spread to my brain. So after having a craniotomy and brain radiation, we thought we were good again. We were wrong. It spread again to my intestines. So Dr. Bickenbach was able to remove those tumors. And since then, for about a year now, we've been being treated with Opdivo, which has been working wonderfully. All my spots continue to shrink every time we scan, and hopefully the next time we scan in about 2 weeks, they will either be gone or even smaller. And so really everything's been working wonderfully for me, and I've come up with creative ways to deal with the side effects of my medication, and really that's it. So if you have any questions, I'm an open book. I love talking about it.
Good morning, my name is Jack Asensio. Excuse me. I was diagnosed 3 years ago my wife and I were going to Tampa to knock off one of my bucket lists, which was see the Yankees in spring training. Put on my Mark Teixeira jersey, felt a little tight, reached under my arm and found a lump. Then reached under the other arm, found another lump. Had a biopsy, it came out positive for melanoma. I had no outward lesions. I suffer from psoriasis, so I go to the dermatologist twice a year. My dermatologist deals in melanoma now, but because I was a former patient, he kept me on. Had no lesions whatsoever. It's called a regressive melanoma. He recommended I go see Dr. Whitman, which was one of the best suggestions I've ever had. Went to Dr. Whitman, he decided to do a PET scan, came up positive with the lymph nodes, but no other area was positive. We decided to have a surgery done, and I went to Sloan Kettering for a second opinion. They told me after the surgery, just do nothing, go home and wait. And I said, I don't think I can do that. Discussed it with Dr. Whitman. He said, no, we're not doing that. He put me on Yervoy. I had 4 sessions of Yervoy. Other than an increase in my psoriasis, I have no symptoms whatsoever. My scans have not changed, and as Mary Baker says, no change is really good. So I've been doing that. I have great support from my family, especially my wife, who's my #1 researcher, and leaves me documents all the time. So I'm here, I'm happy, I'm active. Best thing I ever did was finding Dr. Whitman to stay. Thank you.
Good morning, my name is Al Hine. My first diagnosis of melanoma was in 1993. I grew up here in New Jersey, went to the Jersey Shore, and I had the extra bonus of having Norwegian ancestry, so I was a sitting duck probably. In 1993, I had a mole on my back that I realized was bleeding, so I went to the doctor who sent me to a surgeon who said, okay, we'll take care of that. And he did a biopsy, and of course I remember driving home thinking, well, I guess that's it. I have cancer. I had the surgery where they did as much as they could do, and they sent me home and told me to see the surgeon regularly, and I did. At that time, they called my wife and told her that I'd probably be around for another 6 months, and that was it. And so, there wasn't anything that could be done at that point except to keep an eye on things. So I did, and fortunately, things seemed to go along for quite a while. But in 2002, I realized that I was experiencing tumors in the area on the side where I had had this removed. And so I began to see the doctors at the Overlook Cancer Center. And I had surgery. I had an extensive amount of surgery. That's when they did a rotational flap that removed the entire scar from the first surgery and replaced it with another really fancy one. And after that, the doctor there said, let's try interferon. So for a month or 5 weeks, I guess, I went to the hospital every day and had interferon treatment. And then I went home, and for another 13 months, I gave myself interferon injections 3 times a week. And again, every time I went back to have things checked, it seemed to be okay. And that was true for several more years. In 2009, more surgeries were required. There were more tumors that were appearing in that area. There was also a tumor that was adjacent to the chest wall. They didn't want to do any surgery there, but again, it was a matter of keeping an eye on it. I think this is when I reached the point where, as Dr. Whitman said earlier today, I began thinking of this cancer as my chronic disease. And I could live with that. One of the things that I had discovered along the way was that I could live one day at a time if I really chose to do that. And I knew that each day was a special day, and I was going to live that day as best I could. So this is where I've been for these years until in 2013, we had another appearance of tumors, and this time the doctors down at Overlook said, let's try Zelboraf. So they put me on Zelboraf, and they kept saying, any reaction, any side effects, any side effects? I said, no, not yet. And then on, I think it was the 13th day, I just woke up covered with a rash. My left hand began to swell, and they said, okay, we'll stop that. And then following that, it was decided that maybe targeted radiation would see if they could affect the tumor that was troubling them. It did shrink by somewhat, but it did not disappear. Actually, it was around this period of time that a lot of changes took place in my life, and we moved to much closer to Morristown Hospital. We've been living in Union County. We moved to Morris County. And I realized that the doctors down at the cancer center at Overlook were always consulting with Dr. Whitman, and I said, wait a minute, I live right here in Morristown. In the Morristown area, I should see Dr. Whitman. So I did, and I'm very grateful that I did, because Dr. Whitman has been, following my case and giving me all the opportunities possible. So I spent some time with Maureen, read through all those pages of approval for the clinical trials, and the word was, I didn't have enough disease to qualify for the clinical trials. So Dr. Whitman said, okay, we'll do Yervoy. We did that. Didn't seem to have the effect that he wanted. We did Keytruda. I did quite a few weeks of Keytruda, and that doesn't seem to have done what we had hoped it would do. So I'm currently doing Mekinist and Tafinlar, and the first reaction was a little bit of a reaction, so we cut the dosage, and that's what I'm doing now. So, once again, life goes on, and life goes on, because I know that, okay, I feel fine. My wife always says, you're the healthiest looking sick person I know. She, by the way, is also the person who's always in the doctor's appointments with me with her steno pads taking notes. And so if I don't get it in here, she's got it, and I'm always grateful for that. So, life goes on. We live with this kind of thing, and we say, okay, it's not going to change who I am. And in fact, I guess I've grown because of it, because I've learned to live with something that I can't do anything about except follow doctor's advices and take care of myself. So that's what I did. So thank you.
I was diagnosed with melanoma about 30 years ago in my left leg. I was that slide that Dr. Vickenbach put up there with a major surgery on your shin that they couldn't, with the skin graft, all of my lymph nodes taken out. I didn't have any treatment after that, and I didn't have a reoccurrence with melanoma on my left leg. In 2013, I had melanoma on my right leg, and it was not your typical looking melanoma. It looked more like the top of an eraser. The dermatologist said, oh, I'll remove it, it's nothing. Well, it didn't turn out to be that. He gave me a list of doctors. I went to see Dr. Whitman. I had surgery. We found the melanoma was microscopic in my sentinel node. So I went back in, they took out all my lymph nodes again. And I opted to just watch it, not to go on any treatment. In hindsight, maybe not the best choice. But the following year, when I went for my CAT scan, the melanoma had appeared in my pelvic area. So I had surgery, then again, the treatment with, the tubes in, so it could heal properly. That lasted not the normal 2 to 3 weeks, but 2 months. After that, Dr. Whitman decided that we should go on Yervoy. And I went on that. I had 3 treatments, some side effects, basically just a rash. So I was fortunate, I thought. I never made it to my 4th treatment. I wound up in the hospital because it did attack my lungs. So I was in the hospital, another CAT scan, and we found that the melanoma had then returned to my lungs and in my chest. And at that point, there was no surgery. That wasn't an option. Dr. Whitman said to me, just wait, just wait. They're going to approve this drug. It'll be perfect for you. That was like on a Tuesday. I think on a Thursday, the drug was approved by the FDA, and that was Keytruda. So once I got my strength back, we went on Keytruda, and I had 13 doses of that. And CAT scans came back, the melanoma was gone in my chest. So we were very fortunate for that. I didn't want to go off Keytruda because it was working, and I figured treatment wasn't bad. Every 3 weeks I go for an infusion, and that was fine. But I did have some side effects. I had a lot of inflammation in my legs, and I also had these little bumps that appeared. And the first one, Dr. Whitman was like, I could tell by the look on his face, he wasn't really happy with that, thinking that the melanoma had come back. So I had them removed, and they were fatty tissue. So a couple more, he said, well, we have to remove those. So I think in total I had 4 removed, and they all came back, and he even said, you know, they check it out again, it was fatty tissue. He said, you have to go off of the Keytruda. I was like, really? You know, I didn't mind. So I said, all right. So I went off the Keytruda, and the inflammation in my legs, all of a sudden it was gone. And a couple of the bumps that I had, they started to disappear. So he said, see, I told you so. So far, that was last year in June. I think I started the Keytruda, and I've been off it for a year, and so far so good. I go for a CAT scan in June, and I have to thank Dr. Whitman. They like to see me come to his office because I always bring some kind of treat, like baked goods or something. So.
That's not for me.
It doesn't get me in any sooner, but they